What this ventilator does in a lot of circumstances, and even in the circumstance of a patient who is drowned, this allows us to breathe for a patient who's not able to breathe on their own, or if they're not breathing adequately, we can give them better breaths. What this does, it allows us to give them the right amount of air. It also allows us to give it at the nice, perfect rate that they would be breathing at on their own to try to keep that oxygen in their blood and push that oxygenated blood up to their brain when we do good quality compressions. So this ventilator is pretty new technology. It is actually the highest quality technology that's available in a pre-hospital ventilator at this point. It actually has the quality of some of the in-hospital ventilators as well. But this also, in the case of a drowning, helps us to push some of the fluid that can accumulate in the lungs out of the lungs, which allows us to breathe for the patient and get the oxygen where it needs to go much quicker. So this ventilator can help save lives and also create a better outcome for a patient once we've used it. When somebody has drowned, which means they've gone into the water, they've probably gotten some water in their lungs, they really do need a little more support than just chest compressions. Now, if that's all you've ever learned to do is give chest compressions, that's better than nothing. However, when someone has drowned, it's always better to give them some breaths to try to get them some oxygen in their system, as well as giving the chest compressions. If you've never been formally trained in CPR, which teaches us in a drowning situation to give 30 compressions and 2 breaths, you should call 911 right away, and the call taker will direct you on how to do that. So you will do the very best you can to provide those breaths and give compressions to the victim. Fortunately, as a firefighter and a paramedic, we respond very quickly. We should be there in about 4 minutes, which can seem like a long time to people sometimes, but in the meantime, you should try very hard to follow the directions that you're given by the call taker to provide the chest compressions as well as the breaths to make sure the patient is getting oxygenated as well. The better we are at doing CPR and the longer we are providing the CPR before the paramedics arrive, the better the outcome for the patient. So if we can provide good quality chest compressions and get some good breaths into the patient continuously until the Mesa Fire and Medical Department arrives with their paramedics and all of our specialized equipment, the patient does have a better outcome in the long term if we do provide that continuous CPR.